Some of you may or may not know, but Tenet is one of the largest investor-owned healthcare delivery systems in the nation. We're a Fortune 500 healthcare company. We have 50 acute care hospitals that operate in 12 states. We have 56 outpatient centers in 11 states. We have about 60,297 employees, of which there are 18,160 nurses. We receive about 352,000 applications annually, and we have 12,600 new employees, including 4,600 nurses that we hire on an annual basis.
Each of our hospital has its own HR department and HR leaders, and those HR leaders report directly to the CEOs. Now, keep in mind what this translates into. We have 50 different CEOs, COOs, CFOs, and CNOs. So all of which had very different recruiting processes and selection processes in place. Our goal actually was to build some structure around our selection process to align with the business strategies of our corporation.
At the time we started working with PeopleAnswers, we were using a selection system in about 7 of our hospitals that we had run a pilot on. And what we were trying to do was really attack a problem that is consistent throughout the industry, and that is nursing turnover and retention. Those are 2 metrics that are on our corporate balance scorecard, very critical for us. And we had worked with that vendor for about a year. They used a single profile based on engagement characteristics, and then a single set of kind of off-the-shelf behavioral interview questions that followed that. And we really just weren't seeing the tool get traction and get the results that we needed. So what we had learned at that point is that we did need an instrument like this because it did help us get more objective data about individuals, but we weren't really that effective in using it. You heard earlier that an assessment's really only as good as what you do with it. So we needed some more work in that area. And at the same time, we weren't sure that that the one-size-fits-all approach was really working for us in terms of as we look at the nursing units. And Gary, you might take just a minute to kind of help people understand the different nursing units that exist within a RN function, because I think that would help them get an understanding of the different roles the nurses play in hospital.
Yeah. So for those of you that are not healthcare or don't have a healthcare background, we have various nursing units in our hospitals. You have critical care nurses, you have nurses that do case management, you have nurses that work a med-surg unit, a neonatal intensive care unit, and what you find is that the personality of a nurse that's attracted to a certain unit is very clear. And many times nurses come into the organization and they're not clear about where their competencies are. So they may come in, a nurse may come in and say, I want to work in the emergency room. But after taking the profile, it becomes very clear that they may not have, at that moment in time, what it takes to be an emergency room nurse. And so what this tool does very well is it helps both the interviewer, the hiring manager, and the applicant sit down and look through the assessment to say, I understand why now I'm not ready to be an emergency room nurse, but maybe I can work on getting there. But today, your profile shows that you'd be successful as a labor and delivery nurse.
One of the questions Gary and I kind of had as we transitioned from our prior tool into PeopleAnswers was, what should the profiles look like? In our system, we talk about 3 or 4 different types of hospitals. They're small hospitals, kind of rural, isolated hospitals. We've got some medium-sized ones. We've got some large hospitals that sit right in the middle of an urban center. We've got teaching hospitals, which are, I think of Hahnemann, for instance, in downtown Philly. It's 14 floors, within a couple of blocks of the Capitol, and it's a huge teaching university. Very different. So we thought, well, will the profiles vary in these different settings, or will the profiles vary more by the type of function that these nurses are performing, labor and delivery versus critical care? So it was one of the questions we had coming in.
And it was an interesting process because we would talk to a lot of these hospitals in the beginning, and each one of them, the common theme was, well, we're different. We have our own culture, we do things a little bit differently. So we said, okay, let's see what the data says, right? We're not going to argue with you. You may very well be different, but what Stephen and his team went back and did is we assessed nurses from all these different hospitals, collected data, and what we found was, like Gary said, there are very unique differences across the different modality areas. You know, one nurse in critical care isn't the same as an emergency room nurse, but what we found was at the hospital level, they were exactly the same. So if you're doing critical care in one hospital that may be a smaller hospital versus critical care in a larger hospital, those behaviors that are driving your performance, we didn't see any differences there. So it was an interesting process of really letting the data determine what was the appropriate road to go down in terms of building the profiles.
And to date, and you may be going to speak to this point, but one of the things that wasn't in place was consistent metrics across the board. So working with your nurse executive team, with Zach and with Stephen to create the evaluation that created the performance metrics that went into that.
Every hospital has its own performance evaluation process for nurses. We're required to evaluate them annually under JCAHO standards, and we do that, but each has a little bit different instrument that they use to do that. So what we needed to create was a leveling instrument that would work across the organization. So Gary designated some people on his team, and we worked with them to develop a common instrument, and then we took I think it was 13 or 14 volunteer hospitals that had agreed to be part of the pilot, if you can call it that, once you have, 14 hospitals participating. And I had no intention of it being a pilot long, but I'll admit that now. But through that process, we collected the same data, the same behavioral data across these individuals. Also, because it was a separate instrument than part of their normal performance evaluation process, the nursing leadership felt more licensed to be genuine in how they responded to it, because no one's pay was going to be set on it. There were no consequences. We're caregivers. That's what we do in this industry. And so it's hard sometimes to make those honest calls. And this helped them kind of get past that hurdle. And at the same time, Gary's team could help us hone in on which behaviors were really important when it came to the critical success factors. But going back to our profile methodology, we actually had a pretty good internal debate going amongst our leadership team on whether it was hospital or whether it was the unit or the modality that determined the type. And we all convinced them to let the data make the decision for us and to trust the science behind the process. And that really did help us with support, because everybody could look at the data objectively and say, okay, we all see it now, and it helped us put a significant issue behind us in terms of leadership support for what is important and how should we go about this procedurally. So it was an important step in gaining stakeholder support.
One of the concerns that we had, even though we had the evidence, even though we had the information, was we have hospitals that we measure for a lot of different things: patient satisfaction, physician satisfaction, core measures, which are Medicare's quality indicators, if you will, that are reported, and they're reported publicly. And so our concern was, if we're going to profile an emergency room nurse, might we want to profile an emergency room nurse at a hospital where they do well in all of those indicators? That the physicians are happy with the care, the patients are happy with the care, what they report to the Medicare is right on track, and would that make a difference? And so the evidence showed out, and what the work that you all did, that it really didn't, that an emergency room nurse profile is an emergency room nurse profile. What did change was the units in which they worked, and that took some time to convince people that profiling a group of emergency room nurses in a hospital that didn't do well on those indicators in the emergency room was a difficult sell, but it's working.
One of the things I remember when we first looked at the profiles was just how we were sitting with the nursing team, and we all laughed because the profiles came out almost stereotypical. And if you think about it, this is what you might want as a patient in a hospital, this is exactly the way you want it to go. I want a critical care and emergency room nurse to have amazing critical thinking skills, right? I need triage very quickly, and there are life-saving decisions that need to be made. And I don't want them to have to sit for long and think about the calculation for the medication that I'm about to get. You know, or I don't want them to think about, oh, I wonder what that was they taught me in nursing school about CPR. You know, you want them there. And at the same time, you know, if you're delivering a baby, then, you know, you don't necessarily need, you know, that hardcore critical thinking skills. You might want somebody who more can, you know, who's walked a mile in your shoes, who can be a little bit more empathetic toward kind of the process that you're going through, and who can help you through the process of labor and a successful delivery. So it was fun to see the profiles come out very similar to what our latent expectations are. And this is where Rose, I think, really did us a service. She came up with a phrase and that helped us put the training in terms that really our nurses could understand. She said, critical thinking validates the gut.
Another step in maybe gaining stakeholder support, you know, there were some challenges that you had to overcome as you were rolling this out. So what were some of the things that, the biggest challenges that you had to overcome in this process?
The biggest one that we ran across for nursing was fear. Fear that who was going to see the data, where was the data going to go? What if I, as the manager, took the assessment and it said I shouldn't be a manager? What then? Was this Tenet's way of finding who the bad employees were, the employees that were contributing maybe to the unsuccess of that particular hospital? And so we really had to manage through that process and help them understand that this was really a tool to use to help in the development of your career. That it gave you a document at the end of the day to say, here's your strengths, here's your weaknesses, here's where we're going to help you get to where you want to go. And that took some time.
Well, a lot of times when we're doing the training, we depend at the hospital level on lab reports. And a lot of times we will walk in, assess a patient, and we have a gut feeling that something is going on with them. But until we actually retrieve those labs and really look at the numbers and the data, the hard data, we can confirm that gut feeling. So when they put those two pieces together using the assessment tool and the gut, they basically see it, a light bulb comes on. So they can identify with those scenarios in those situations. Another factor, a point that they brought up in this whole implementation, is that from a recruiting metrics perspective, they thought that that would decrease our applicant pool in terms of the timing it took for the RNs to actually complete the assessment. And on average, it's about 30 to 40 minutes at best. And we have seen no decrease in our candidate pool at all. As a matter of fact, I think this year we're actually have an increase in the candidate pool. And as we go through the discussions today, Stacey will touch on some of the feedback that we've got, not only from the hiring managers, but the applicants in terms of their experience. So we were very cautious in what does this actually do to our applicant experience. And what we've seen so far is that it has greatly improved the applicant experience by using the tool.
This slide sums it up for us a little bit. What we did is, as Joe mentioned, you know, we had a pilot that we were doing in 7 hospitals, and we didn't see the results we were looking for. So what we did is we kind of got together as a leadership team and brainstormed on what's working and what's not. And so we wanted a really solid assessment, but we also realized that if we didn't have the structure around it, that we weren't going to get the results that we were looking for. So, so we put some structure around it, and we call this our selecting talent system. And as Rose said, we had 50 hospitals doing it 50 different ways. Yeah. So we felt it was important to define what their process was going to be. So real quickly, we just went through, we set up so they had a structured pre-screen by the recruiter. Our career profile is our PeopleAnswers. And then we move into the behavioral interview. So we train them on how to use the information they get from the PeopleAnswers. What you find with our process is the PeopleAnswers really feeds every step beyond once they take that PeopleAnswers assessment. So whatever the PeopleAnswers told them in the assessment, they used those must-ask questions during the behavioral interview by the managers. And we also created peer team behavioral interview templates that they use during the interview that focus in on the most influential characteristics that PeopleAnswers identified for us. So the peer teams don't have access to PeopleAnswers, but we still use it during that peer interview process to make sure that we're drilling down into those characteristics that are really important. And then, of course, once we spend all that time on the front end, we want to make sure we keep them there, so we have a structured first 90-day process that we're putting in place with this. And what we found is putting that structure around it, it really helps the hospitals understand why they need the PeopleAnswers tool and what it can be used for. It's not just, as Joe mentioned in our first pilot, it's not just information we get in front of us, but what do we do? How do we operationalize that information and make it work for us? And so we gave them all those tools at the bottom and a structured kind of implementation plan that was customized to their hospital so that they could understand the importance of the process.
And we'll talk a little bit about the rollout plan in just a second, but there were some things, and you talked about how PeopleAnswers feeds the rest of the process. There were some process changes, improvements, standardizations that came about from this implementation, but there were also things that you learned from the pilot that didn't work out that you could change and improve upon as well to improve these processes. You want to add anything to that or talk about that and how you used it?
I think there were a few things. One of the things we learned is that we've been doing behavioral interviewing for years at Tenet. We've trained behavioral interviewing for years. And so when you asked, everyone would say, you would say, do you do behavioral interviewing? And they would say, yeah, we do behavioral interviewing. And then if you asked any follow-up questions, it became apparent that maybe they were asking the right questions, but they weren't evaluating the answers. Or maybe they were evaluating the answers, but at the end of it, they were still making a decision based on kind of their gut. How did they feel about that candidate? And so what we didn't see is the flow from information to a good, solid decision about the person. That was one. Another is once we collected, and even in the instances where we'd collected it and used all of that information, it died in the selection process. So the person came on, and then they walk in the first day, and we act as if we're ignorant of everything we've learned about them, and we just start over. So I think there were some opportunities for us to improve the process. A third piece, I think, is that we saw that we really needed to do a lot of training around how to use the instrument. The healthcare industry has just been kind of on the tail end, I think, of adopting a lot of assessments that I think have been used in other contexts for a period of time. We're very advanced clinically, but from an HR perspective, I think we're just in the last 5 years really maturing, and so the assessment instrument, the use of an assessment instrument properly, not my person is a score, but really beginning to understand how these characteristics are going to work as we get that person onto the unit with all of the other people that I already have. That is a level of sophistication that we really needed to grow.
And one of the other things that Joe's brought up that was important for us is, let's say you have an applicant who, 23 years old, and they're in that generation, and they're interviewing with a 55-year-old nurse manager who's been a nurse manager for the last 30 years and is pretty set in their ways. And so how that applicant responds to that behavioral question and how that interviewee interprets that data can be very different. And healthcare has moved a long ways, and we really need, and this helps us to start training those interviewees that what is an appropriate response generationally for what's happening in today's world, and really helps us to begin to train those managers to think differently, that someone coming in that doesn't want to work 3, 4, 5 hours of overtime a week because they value their life-work balance very differently than the 55-year-old that's interviewing them, and that doesn't make them a bad candidate. But previous, you could have been knocked off the screen if you would have responded to someone in that generation that you're not interested in doing overtime. And so it really helps to begin that training about the different generations and what the level of expectation they have coming into the workplace these days.
So training's been a big part of the rollout strategy, and Joe joked about how it was a 13 hospital pilot. There was another program that was already in place. So Stacey, why don't you talk a little bit about how this started? How did you guys decide to roll out? How were the hospitals identified? And how did you engage such a large, diverse user community?
Sure. Actually, when we very first started, we had, I think, kind of two different programs going on. We had PeopleAnswers, and then we had this behavioral interviewing or process improvement. And once we got these kind of moving in the right direction, we realized that it really needed to be one initiative, and so we rolled it all together. I think that's one thing we learned very quickly is without the structure around it and us giving them some guidance on how to use the PeopleAnswers tool, they weren't going to take full advantage of it. So, so what we did is we created a structured implementation plan, and we did this at every hospital that we've been to. And really, we spent some time on acceptance. We talked to the hospital leaders. And during this, we've already been talking to leaders. We talk on regional CNO calls. We talk on regional leadership calls. And so we're always out there discussing what is selecting talent, what is PeopleAnswers, and how is it going to help us. But we take that to another level and really spend some time with the A team at the hospital, with the HRD at the hospital, and really set the expectation up front, that this is a process change. This is a culture change as far as who you're going to hire. Traditionally in nursing, when I became a nurse recruiter the very first time, I was told, don't let a nurse walk out the door without an offer. If a nurse walks in the door, don't let them walk out without an offer. And so we have this mentality of, we got to get them an offer. They have 10 years of experience. The joke is they have a pulse, they have 10 years of experience, make them an offer. So changing some of that culture, and that's not a Tenet, that's healthcare as a whole.
Yeah.
That was way before I was at Tenet.
Because of the shortage.
Because of the shortage and how much we need, we need nurses in healthcare. And so, so it's really a culture change in talking to them about how do you make sure you're finding the right fit. So you may have a nurse with 10 years of experience that you may say no to. And that goes to what Gary was talking about, is how do we change that interview process to say, we're going to find the people that are the right fit, and we're going to pass on someone that has some good experience. And so that acceptance that we do at the beginning is so important in making this work, and the hard wiring when we get to the end. Then we spend a lot of time with Ruthie and Allison and Zach on the road. We do live trainings for all of our hospitals for PeopleAnswers. It's a technical training. We bring them into the computer lab. We get the nurses on the computers. We opted for the live training because, again, our directors and managers aren't at a desk. So even if we did a webinar, they've got 10 million other things going on. So we have them kind of captive in a room for 2.5 hours and really show them how to use the tool. And we get them in there really looking at candidates and seeing how it's going to work best for them. And then once they use that for a couple weeks, then we go back and do the behavioral interviewing piece. So now you've had time to learn the technology and learn how to use the tools. Now let's talk about how you're going to use this for your interviews, for your coaching, for your first 90 days. And so we spend actually another 4 hours with them in training on behavioral interviewing. And then we also train their peer teams when we go back that second time. So we really let the HRD at the hospital take the lead on this, and we kind of project manage it, and we have a structured approach that we give them to give them the tools they need to be able to implement it.
And like Stacey said, I think one of the keys for Tenet, because it was decentralized. They have all these hospitals. Stacey, I was trying to count how many times she said we talked to the hospitals, but that's what they did well. They communicated. And I remember when we were doing the pilot, it was literally a webinar every week with different hospitals saying, this is what we're doing. This is why we're assessing your employees. This is why we're collecting data. So it was a lot of work, but the buy-in, it was invaluable in terms of getting the buy-in from the hospitals, because they knew this was the process, this was the plan, and this is where it's going to be taking us. So there wasn't anything being hidden in terms of why we were doing this. Everything was up front. So in the beginning, we were kind of pushing the rock up the hill trying to get everybody on board, but because, like Stacey said, it was so structured and there were things put in place that it's kind of gotten over the hill, and now there's hospitals saying, we want to be part of this. We want to bring PeopleAnswers on. So it's building that right structure in the beginning, and then starting to see the fruits of that come out in the end.
And you're exactly right. Yesterday, I had my monthly call with the California region CNOs, and the reason Stacey was on the call and so was Rose, because they've heard about the success in our other regions we have 4 other regions, and they were wanting to know, when are we going to get it? How's it going to be launched? When is the rollout? And so it actually does create a synergy because they all and that's how you get it really bought in. Yeah. Other CEOs and other chief nursing officers start talking about the success that they're having with the program, and before you know, it's a pull strategy versus a push strategy. Yeah. And that was sort of the strategy that we had is, let's find some hospitals that we know sort of think outside the box, that are okay with things going wrong and that you need to get back on track. And we did that through the CEO Council and the Chief Nursing Officer Council, sort of selected hospitals that we know that we could work with that senior management team and go through this process together.
Yeah. And I get calls daily because, you know, right now we're getting close to the end of the year. They're starting to plan for next year. And we, at this point, because we did all that great communication on the front end, I can't keep up with how many calls we're getting for, hey, when are you coming to our hospital? Tell me a little bit more about it. So there is really a synergy around it.
Very good. So that kind of ties into, from the reception to what's some of the feedback? I mean, how's it impacting the lives of the people that are actually using the tool out in the field?
Sure. You know, we're getting, and I was joking earlier with Joe, the slide's actually wrong. We've been on the road so much lately. We've been at about 25 hospitals. We have it live in 25 hospitals now. Since last week, and about 1,800 people that we've trained. Overall, our response from the training itself and the tools that we're providing, it's 95% or higher. The reason actually that it's at 95%, I think, is because when we go into the training, some folks feel like, as they've mentioned, we've been behavioral interviewing for years in our hospitals, so a lot of folks come in thinking, I already know how to do this. So we have a small percentage there, but the majority walking out with the PeopleAnswers tool and with the behavioral interviewing are saying, wow, this is really going to add value to us. And what we were excited about is, you know, some of the pushback that we got, as Rose mentioned, is from are candidates going to accept this? And we have seen very positive feedback from our candidates that are sharing willingly their experience. And these aren't even necessarily people that we've hired, but just after they've gone through the process, they like the structure. They like that we've spent so much time with them. Because again, before maybe you get a 15-minute interview with a nurse manager and get an offer. And so now they're like, wow, they're really spending the time to get to know me and know that I'm a fit within their unit. So not only from the managers, but from the candidates and the peer teams just being involved in the process. But they were involved before, but with PeopleAnswers, it's allowed us to focus them in on what's important to the job and make a recommendation to the hiring leader. So they're not just selling a candidate on the job. They're not just doing, you know, a standard do I like you interview. They actually have structure because PeopleAnswers has given us those influential characteristics to focus in on. And then they give a formal recommendation back to their leader whether they think that that person's a fit. They really like being involved at that level in the process.
You know, another thing when we train the hiring leaders and the peers, on the units, when we're talking about building a very strong team on any clinical unit, they must have different variations of talent too. So it gives the peer teams an ability to see beyond what they're missing to see if this person potentially can bring something to the table that's valuable for them. So it gives them a way of building a very strong team, a very strong and well-functioning team. So it gives them a lot of insight into who they're hiring.
And that insight's been kind of interesting in the field. You mentioned an example the other day about your CNO in Hilton Head.
Oh, I think, yeah, that was Joe, your example. The CNO that pulled you aside said she made you made her do it.
Yeah, we were at a last leadership conference. My chief nursing officer at Hilton Head, she pulled us aside. She said, that Joe Gage made me do that, selecting talent, and which is the brand we're rolling it out under. And she said, and we had a termination, so they traced it back through, and they said she said, and it was all right there in the profile. And she was kidding, but she was seriously saying, look, this is validating. And one of the things that that we're now beginning to do is Gary and I have started a separate process, these intensified turnover calls with hospitals, where we really trace the causes for turnover person by person back through. And we will trace a person all the way back to okay, tell me which peer interview team hired them. Okay, tell me what you saw in the profile. And those calls are enormously valuable in helping us also drive this process even more deeply into the fabric of the organization. So reinforcing it with some of the other initiatives that we've got going is another way that we've gotten traction.
Yeah.
So that's a good segue to the next slide, talking about turnover and how it's aligning to the goals that you set out for the program and that you have for your organization as a whole.
So in I think it was August, Gary and I got to present to the senior team at Tenet, which is kind of the officers, and it's always a good time to have your peers check your work and to validate how they think you're doing. And for us, we used this slide, which showed that coming into the recession, we were making some pretty good progress. We had dropped from 25 to 20 in 08, and even down into 17 at the end of 08, when really the bottom started, it fell out. And we had also begun pushing first-year nursing turnover, and yes, that says 44%. And now we've got it down into the 29 range. We're not set there yet, but we're going to continue to push that one. But what we had is a good positive trend going because of this work. And we've been able to accelerate it through this and some of the other programs that we've been doing. So as a package, our leadership team was able to say, you know what, we definitely got a lift from the recession, and that's great. But everything that you're doing, you need to keep on it, because when we come out of this thing, we're going to need these programs in place. We believe that they're already working. We want them to continue. You know you're getting the right question. When I knew we had it right is when we're in 20 hospitals or so, and we're having a discussion with the COO, and he said, why aren't you doing this everywhere? And I'm like, oh, that is a great idea.
And so for the skeptics in the room, because I know you're looking at this slide, especially on first-year turnover, going from 44%, which is when I was a high-risk employee after 17 years with Tenet, down to 29.9%. Yeah, there were other things that we did besides PeopleAnswers, and it was really one thing, and that is that we brought on a residency program for all of our new graduates. So where this ties in is we use the PeopleAnswers profile to profile the new graduates that are coming in, to make sure that we set them up for success, make sure that we put them in departments that they're better fit for coming out of school. Back to that whole, I want to be an emergency room nurse, this is where I want to work, but they really don't have the profile coming out of school to be, and some do. Some of our graduates go into our intensive care units, but it's a smaller percentage than what it used to be. And so we use this tool to actually profile the new graduates to make sure that we put them in the right place. So then again, that has helped tremendously to drive down the turnover, because they feel better about what they're doing at the end of the day. They don't come into the job thinking it's going to be one thing, and then they get to the emergency room and it's, oh my God, I had no idea. And then there you go, you have a turnover.
You also don't hear that grinding, when a person's interpersonal traits don't fit the job. You can just hear that grinding, from their workstation, and that goes away. I think it also helped us with the sell, to be able to say, look, we've got an instrument, we can learn a lot about you, and we can show you that you match, the profile for our high-performing labor and delivery nurses. You ought to think about that career track. It's an investment in those individuals, and that's very different than we're going to assess you to see how good you are.
And the reverse is true. So you would have a candidate come in saying, I want labor and delivery, but they really are profiled for ED, and they never thought about working in an emergency room. Mm-hmm. And that's an opportunity where you really work with the candidate and say, let's try the ED. And because they have the personality traits that are going to make them successful there, you'll find they're very successful, because that's the environment that their personality is better suited for.
And that really helped us sell it at the hospitals.
Yes.
I will tell you, as we go out and do the training, and those directors and leaders in there, being able to see that career path where they can see all 6 profiles compared to the candidate, they really value the fact that a recruiter can speak with that candidate and really point them in the right direction. So that really added a lot of value in selling it at the hospital level.
Especially for the Gen Ys.
Right.
Yeah.
Because 6 months is what they give us.
Yeah.
So the thing is, you know, we have to give them something.
Yeah.
We have to give them something on the front end. So as long as we have a plan, they're ready to go.
Yeah.
So it actually gives us a roadmap, really, to their career path throughout their clinical.
Especially for a lot of new hires who have just less life experience, and they haven't had the opportunity to test themselves to know what environments they're successful in. This really helps us get them directionally oriented.
And turnover in nursing is critical for a number of reasons. It affects, your cost of turnover is a very high number. And it also has an impact on the quality of care, the physicians and the way that they're driving their patients to your hospital. So there's critical life and death factors that turnover in nursing can contribute to as well.
Absolutely.
So you've learned a lot in this process and the rollout. Is there anything that you would do different or suggest to the audience?
Don't be afraid to set expectations for those that are receiving the instruments and using the instruments. I would say that you can't do enough to structure the process and provide them project oversight as they're implementing the tool. Stacy has just done unbelievable work. We don't ask her to be the hammer, but we ask her to work the process for us. And Gary and I get to be the hammer. It's one of the fun things in your job. But structure the process. Never miss an opportunity to talk about the instrument. We have done, I don't know, tens, maybe hundreds of calls with people to show them the instrument, to show them how it works. I never decline a request from Gary to do an update. If I can't get there, I get somebody there that can talk about what we're doing with it and what's going on with it. And so we're very transparent about just our journey.
What are some of the other keys to success? And maybe Zach, you can help out with this. And you guys had stakeholder buy-in at the hospital level, both from the HRDs, your A team, which are your executive teams in the hospitals, your CNOs, who's in charge of all the patient care and all the nurses out there. But you also had, you're talking about communication and transparency into corporate to your leadership ranks. Right. So there was a lot of different buy-in that you had to get in 50 different CEOs and 50 different hospitals. So some of the keys to success, we've talked about them. But Zach, maybe you can add to what you've done to help out there, I guess.
Yeah, and I've been thinking about this as we've been sitting here. I mean, there's 4 things, and it all started with the profiles. I mean, Tenet really brought us in as a partner to say, we have this information, Stephen, go look at it and see what is it telling us. So from the very beginning, everything was set on valid information. So it's easier to go sell it. And then communication, like I said, was a huge piece. I mean, I think that really set them apart just in terms of the success that they set themselves up for. Process was a big piece, and then kind of the biggest one in my mind that sticks out is you've got, I mean, this probably isn't everybody, but 4 internal champions within Tenet. So, they knew it was going to work, they wanted it to work, but they communicated to their team, this is why it's going to work, and we expect it to work. So I think having that confidence from the front end driving out, I think it breeds that confidence in their team that the people are behind this and they expect it to work, and we're going to push and make all the necessary changes. And one quick example from Stacy's point of view, we were talking a couple weeks ago because we were seeing a lot of the new grads coming in and they were triggering the authenticity alert. So it's kind of thinking ahead and figuring out what are the issues, how can we solve it. So it's really going back to the recruiters who are recruiting for these new grads and understanding how can we better communicate to them. Make sure that they understand we're looking for who you really are, not who you think a nurse should be. So it's getting ahead of those issues early and trying to understand how can we tweak the process to make it better down the road. So little example of really being proactive and out there and communicating and knowing what the hurdles and what the challenges are with the team.
Brad, one of the things that we didn't mention is really the hardwiring of the process, because it's great to go out there and do the initial implementation, but the follow-up afterwards, just to be checking in with them, making sure things are going okay. We do a monthly report back to them. If they have any RN go through the process that didn't take a PeopleAnswers, we see that on a monthly basis. I go back to the recruiter, ask them why would this person go through without taking a PeopleAnswers, and then now we go back, as Joe mentioned, and look at the terms too and say, okay, why did this person term, explain it to us. So really that follow-up to let them know we are checking, we want them to be using it, it is going to add value, and then as we hardwire it, they start, again, they become the champions and they go out and they're telling what a great tool it is.
And you guys are a metric-driven organization, and you're kind of driving Zach to create some really interesting reports as well. On
I thought you said you were going to say we're driving Zach crazy.
Probably that.
That'd probably be fair.
Yeah.
And the thing that's not on here is what would, something else that we need to do concurrently and do better, and we have a commitment to do that, is we're doing a great, this is doing a great job getting the applicant in the door and getting them onboarded and hired. Now, if you look at all the data around turnover, what's the #1 reason why an employee will leave the workplace? And it's usually their supervisor.
Yeah.
And so we need to make sure that we're profiling our supervisors, because all of this money and all of this work, all of these efforts go right down the tube once we have a turnover. And back to what Stacy's saying, you can't have someone not go through the process, because the minute they term, everyone believes, it didn't work. There's one that just left. So that's one reason why that has to be consistent. And the second is we need to make sure we get our leadership through these profiles and get their developmental plans done and get them on a path of getting more successful, because we don't want to lose the candidates. And that's sort of our next wave of focus, if you will.
Yeah.
Probably have time for maybe 1 or 2 quick questions if anybody in the audience has something, and then we can also grab them at lunch or afterwards. But does anybody have a quick question? How do you select which peer members will interview potential candidates?
Good question. We actually, as part of our acceptance process, we have a structured process where we have the HR director communicate with all the hiring leaders at their hospital. We ask them to pick 10% of their population to be trained. And we give them a list of what they need to be thinking about. So they need to be top performers, they need to be role models within their department in nursing, their preceptors or charge nurses. And we give them also some guidance on the fact that since we are 24/7, they need to have people from night shift and day shift, but they need to stick to those top performers only to be part of that peer team process.
Also, look at their PeopleAnswers profile, because if the selection bias, I hire people like me, I mean, use it to your advantage.
Yeah. So far, we've had a small population that's termed that actually has used the PeopleAnswers profile. I mean, last time we looked, it was less than 20.
Yeah, it's very few.
It was very small. And so with those folks, what we found is a lot of them are around orientation versus selection at this time.
So using the instrument to help in the onboarding process?
Yeah.
And that's what we're looking at, expanding it to.
Yeah. But it does happen. It happens often enough. It happens often enough that I would say that at most of the places where we are now, that's a common question that our leadership, hiring leaders, are getting the habit of asking.
Yeah. And Rose and I, it's funny, both of us have encountered this numerous times where a recruiter will call us frantically saying, this profile says don't hire this person, but the manager really wants to hire him, what do I do? And in both of the cases that we ran into, it was a rehire. And so we said, well, go pull their file, let's take a look at it. And I can't even tell you how exact their performance evaluations were to the PeopleAnswers assessment. And so the recruiter was able to go back and say, look, this is how they performed last time they were here. This is their PeopleAnswers. I don't think this is someone you want to move forward with. So again, that back to validating your gut, it gives the recruiter something to really stand on and say, this is really going to help us make a hiring decision.
It's that along with looking at the quality of your hiring decision. Just because somebody is eligible for rehire doesn't mean that we really want to bring them back. So it's having those discussions with the HR teams when we're doing the training in terms of, because our rehire population, I would say, is about 15%. So it's a high rehire population that comes back. And the good thing about it is it does even give the two more credibility when we actually pull the file of that employee. So,
it does.
Yeah,
Those that maybe didn't 100% believe in it before, when they go through that process, believe in it more.
Although balance the use of the anecdote, because it's a two-sided sword. Because one, just like one data point does not a body of evidence make. We say, look, the tool works over broad populations. We know that if we apply it nationally, we get the results. We're not guaranteeing every decision. This is a data point for you to use in the hiring process You're the hiring manager.